Okay, so we'll start with assessment of a dorsal glide at the hip. So your patient's going to be lying down supine on the table, and I'll have her scooch towards the side to be tested, so in this case the right side. Okay? Since the stationary partner in the joint is the pelvis, we need to stabilize the pelvis, and we're going to do that by using belts and wedges today. So the first thing I'll do is palpate for her PSIS and place the wedge behind her PSIS and check that it's firmly against the wedge by pressing the ASIS down into the wedge. And then I will place a belt over the front of her pelvis to hold it stable. The belt to be placed over both ASIs anteriorly and then securely tightened. And now we should have stability of the pelvis. Once I've done that, I can position her test leg into resting position, which is 30 degrees of flexion, 30 degrees of abduction, and slight external rotation. And then I can contact the femur proximally, holding her in resting position. As you can see, she's still supine, stable there. I need to lean to get my direction of force, posterior and slightly lateral. Okay, so now from a different angle, dorsal glide at the hip again. I compress the adductors and soft tissue and give a posterior and lateral force to assess the dorsal movement of the hip.